My name is Dr. Craig Nicholson. I am the Medical Director of the Robotic and Minimally Invasive Surgery Program at St. Rita's Medical Center. The great thing about doing surgery with the Da Vinci robot is what it allows us to do both for the patient from a short-term perspective and also from a long-term perspective. It allows us to go inside and do things that in many ways we wouldn't be able to do even with a large open incision. One of the other great things is that the average blood loss on these surgeries is a lot less, which means patients recover a lot more quickly because there's a lot more energy that you have after surgery.
For patients, the benefits of minimally invasive robotic surgery don't stop there.
The smaller incisions mean a lot less pain, means less chance of developing, for instance, an incisional hernia postoperatively. It allows you to get back to your normal activity much more quickly than you would otherwise. I've had patients who are ready to go back to work at just over a week after surgery. In the old days, when we found a tumor in the kidney, you have two kidneys, so we would just take the entire kidney out. What we're able to do with the robot is what we call nephron-sparing surgery, or the preservation of as much of the normal kidney as we possibly can. We're able to go down in, we're able to take out just the kidney tumor itself, and then we're able to, because we can sew as effectively as we can with the robot, we're able to close that defect in the kidney, do this laparoscopically, again with the same small incisions, do it effectively, where we're able to remove the entire cancer, but at the same time we're able to leave the majority of the kidney in place. When we do a robot-assisted laparoscopic prostatectomy, a couple things. Again, we do smaller incisions. Normally you would have a large incision that goes from approximately the belly button all the way down to the pubic bone or the bone at the top of the pelvis if you were to do this open. Instead, we use 6 very small incisions. The largest of these is only about 1.5 inches long, and it has to be that big just really to get the prostate out. We are able to go down deep in the pelvis. This is not a place that's easy to get to, even doing open surgery. For instance, when we do what we call the anastomosis, that's where we sew the bladder back down to the urethra after the removal of the prostate. In doing that open, we do it with interrupted stitches, and a lot of times we're tying these down just by feel. You really can't see down in there anymore because the bladder's in the way. When we're doing this robotically or with the help of the robot, it allows us to actually see down in there while we're doing the anastomosis. We do a running anastomosis, meaning that we stitch all the way around with a continuous stitch. The first thing that everybody's concerned about, obviously, is cancer control. This is a cancer surgery. They want to make sure that we're getting all the way around the prostate. We can do that very effectively with the robot. In many series, we can do that as effectively, if not more effectively, than we can do it open. For most men is probably incontinence. Many men are coming in already with some erectile dysfunction, and that may not be as important to them as making sure that they don't have a urine leak. Most men, if they're continent beforehand, are going to end up being continent afterwards. There are many surgeries that can be done robotically. From a urologic standpoint, we talked about prostates, we talked about partial nephrectomies for kidney tumors. I've done cystectomies where for bladder cancer we have to remove the entire bladder. Here we're going to be offering the entire package. We're not going to be doing 1,000 of these like some places do. We're going to be doing a number that we can actually take care of the patients, again, from diagnosis through to the very end. And then we're going to be following these patients over the long term as well. I think being able to have this done near home, being able to have it done as well as you could have it done literally anywhere in the world, is invaluable to patients.